this mission we have codenamed Career Quest.
Alex! Martha! Ashley! Mark! Samantha! Ashley! Alex! Aaron! Mark! Any luck? Mark! Alex! Any luck? No. Didn't see anything.
Samantha!
Ashley? Alex?
Oh, a banded puppy. Can we keep him?
Under one condition. You have to take care of it.
Yes, I love puppies.
Let's go back to the clubhouse.
All right.
Boy, keep knowledge. I know. But look, I was at school today. All people got me here.
Yeah, what? See, she said, what? I showed you. Yep, I came in.
Shoot, I thought it was them. What's that stupid yelping? Aha! What's this button do? Finally, I found the clubhouse. Oh, I better hide.
Tired. Why do I have to carry the dog food?
You're so lazy. Don't ever talk to me about being tired.
What are you talking about? I've been lifting weights all day.
We're just going to be quiet. I'm to study. Oh, yeah. The world's supposed to stop for you to study.
It looks like the dog's chewing on something under the table.
Well, Busters, this will be your last day.
Guys, I think we have an unexpected guest. I mean, a very unexpected guest. Oh, no. It's Vapor.
Any other time I would destroy you, but humor is understandable from some facing certain doom.
Why do we take this stuff from this guy? We just kill him.
Hi, I'm having fun. Just wait.
I have an idea. I get the front and shine, you get the back.
That sounds kind of funny, guys. This is no time for your ignorant jokes.
Anyway, Aaron and Lisa, you tie him up when I say so.
Okay.
Oh no! I think the questions might actually catch me. I can't believe it.
Well, you better.
I don't think so.
Oh, man, he got away.
What do we do now? He has the puppy and now he knows where our clubhouse is.
We should need to contact Zoe. She'll know what to do.
I'm on it.
Yes, Scares, what can I do for you?
Vexer took our new puppy.
And now he knows where the clubhouse is. I'll take care of Vexer, but you four should start another mission.
Oh, good. Another mission.
Well, since we need to learn how to take care of a puppy, why don't we go to a veterinarian?
Okay, but watch out for Vexer. He may be tracking your signals.
Everyone ready?
I was born ready.
Whatever.
Morphatron, activate. Set coordinates for Flushing Animal Hospital. Energize.
Look, guys. Piggy.
And that's enough for one cat.
So dogs for slow goes.
Do they have,
They're not real pig ears.
make the fleas come out and like flea spray?
You're welcome. Bye-bye.
Can puppies have these?
Yeah, they love them. They like to chew on them.
Is there anything that like huskies like the most?
They always like those pig ears. Those yucky old pig ears.
Are they real pig ears?
Yes, they are.
I told you.
They're real?
They're real.
Nice to meet you, Emily and Dr. Liggett.
Hi, I'm Alexander.
Alexander, it's a pleasure.
Hi, I'm Brandon.
Bradley,
Brandon.
Brandon,
Hi, I'm Alexandria.
nice to meet you all. So let's go take a tour of the Flushing Animal Hospital first for starters and see what there is in here and what we do to take care of dogs. And then we'll sit down and talk about some of the things that you came here to find out more specific information about. This part of the building is where the dogs stay with us when they're boarding and the owners are gone. Each one of the rooms has individual cages, and we take them outside and walk them and play with them and let them go to the bathroom twice a day. If it's raining outside or the weather is really, really cold and windy, then we walk them on the grass inside the building so the dogs can go to the bathroom on what's normal for them, because they're not trained to go potty on the cement, and they get sick sometimes if they don't have a chance to go on the grass. What this lady is doing is grooming one of the dogs, and it looks like a snowstorm in there almost, because those long fluffy dogs have what's called a double undercoat, and when they dry them it just flies all over the place. This room is what we call the treatment room, and when the dogs are in the building and have to have, like in this case, the dog's teeth cleaned, or get ready for surgery, or maybe they have to have blood tests done and we have to draw some blood. We do all of these things in this room. This is Margaret doing the teeth cleaning, and this is Dr. Crow, who is a patient. This dog also has to have some bumps removed from its body to see if they might be cancerous or if there's anything that we should worry about in those. This is the surgery room, and for anything other than a very, very, very minor surgery like sewing up a cut, we move them into here.
Why do you have the windows covered?
Because we also use this room to do ultrasounds, and we need it dark to be able to see the monitors on the ultrasound machines. I just moved it into this room a few weeks ago, and we haven't got the new blinds up there. Eventually we'll have some blinds up there, but they haven't come yet because they've only been ordered a couple weeks ago. If the dogs have like a broken bone and we have to take a picture of the bones, this is the X-ray machine. Now sometimes we take pictures of things other than broken bones. There's a dog that we've been seeing. It's been having trouble going to the bathroom. It dribbles pee just all of the time, and a lot of times it's red and bloody. And of course that makes an awful big mess in the owner's house. And so Dr. Crow examined the dog, and he thought something felt funny in his belly, and so he took a picture of the dog, and this is a picture of the dog's belly on the inside. This is the backbone up here, and this is his rear legs back here, and you see all of these white things inside there. Well, those are stones that are formed inside the dog's body, and they look like solid white stones like you would pick up in the yard. Did you have a question?
When they have stones, my grandmother had to have surgery for the stones once. Is it the same for adults as for dogs?
Yes, it is, and that's what this dog needs to have done, is we need to do surgery on him and cut the belly open and take all of the stones out and then sew everything back together again.
How do the stones form?
Good question. Sometimes a dog will get a bladder infection, which happens fairly commonly. In some cases, the minerals, the normal small pieces of particles that the dog's body eliminates daily, will clump together around the bacteria, and it'll just clump together in bigger and bigger and bigger clumps until they have a stone. It's kind of like the way oysters make a pearl. Now the ones in that dog are much, much bigger than this, but that's more or less what they look like. They're just little hard white stones. When the dogs and cats are sick or have to have surgery, we keep them back in this room. It's one of the rooms we keep them in cages. Like this cat, for instance, with the lines hooked up to him, is a very, very, very old cat that has diabetes, and now he has kidney failure, and so we're treating him to hopefully make his kidneys work better and let him go home again. This cat is in here also to have its teeth cleaned today.
Do you only keep the cats in this cage even though they're big enough for dogs?
No, we keep the cats and the smaller ones and the dogs and the bigger ones.
So you keep, even though the dogs and cats may not get along, you keep the dogs sometimes under the cats?
Yeah, because when they're in this room, they're sick. And so when they're sick, then they don't have any problems getting along with each other because they just don't feel good enough to. When we have to draw the blood and run the tests, this is the room that we do this in. This is called the laboratory. And these machines do different things with the blood or the urine or whatever we need to tell us what is wrong with the animal and what we need to do to fix it.
Is that blood from a dog?
No, this is a stain that we use. Sometimes if a dog has a bump, we'll take a needle and stick it into the bump and squirt that little tiny bit of stuff onto a piece of glass. And then we'll dry it and dip it in those different stains so that we can look at what's there and hopefully get an idea of whether it's cancer or whether it's just nothing that the owner needs to worry about. So it's just a stain to let us see things.
Are there any dogs in here?
Over in the other part. This is the rooms where the dogs stay with us when their owners are on vacation. And each dog does have its own individual cage, and the cats are kept in a separate room so that the dogs and cats are not together. Because these dogs, the cats that would be in this part of the building, are healthy, and so they might bark at each other.
What are the bottles for?
The bottles, if the dog comes with collars or leashes or medicine, we have to keep them someplace with the dog. And plastic round bottles are the only things that we found that the dogs can't get their teeth on through the cages and chew them up. We've tried other nice containers, but they always get chewed up. But these things being round, if the dog does get through there, it tends to push them away. They don't look very nice, but they do keep the animals' belongings together without getting them chewed up.
Do they ever bite on the string sometimes and like let it loose?
Sometimes, then it just falls, and that's all right too.
What is the time limit for
But all the dogs are kept off the ground so they don't have to be laying on cold cement. And they've always all have little benches with,
right now is pretty nice.
these rooms are the suites, and sometimes the owners want the dogs to have a television with them and have the windows to watch the courtyard. So I guess you could say that the dogs that stay here are pretty pampered dogs.
So he's the only one that stays in here?
Today, by tomorrow, this room will be filled up completely.
How long do you have to stay in college?
To be a veterinarian?
Yeah.
You go to 4 years of college, and then in your third or fourth year apply to the professional program, and once you get in, it's 4 more years of college, so 8 years altogether. It's basically the same program as any medical doctor would go to. Instead of working with only people, you have to learn about dogs and cats and horses and cows and pigs and sheep and birds and lizards and snakes and turtles and just about everything. So it's actually a lot harder to be a veterinarian than it is to be a doctor, because they only have to learn about people.
You have to go back to college every other month or year.
No, not to college per se, but you do continue to have to take classes 8 or 10 hours a year minimum. I go to school, and I graduated 20 years ago, and I go to at least 10 days worth of classes a year to keep learning, and then read lots of magazines all the time too. So you never stop learning. It's just that you pay more money for it when at school than you do when you're not at school.
How much does a veterinarian get paid?
It varies. A newly graduated veterinarian will make $35,000 to $40,000. An experienced veterinarian can make well over $100,000. It just depends on what you're doing and how long you've been doing it. For instance, working as a veterinarian in a drug company, for example, they tend to make more than a university professor would. And a small animal a practice owner tends to make the highest amount of money as far as a veterinarian goes.
How much do you get paid for breeding the dog?
Well, a veterinarian usually is going to just get paid the consultation fee, because most of the time the veterinarians don't have to be involved with breeding the dogs at all. Breeding a dog is not something that you can particularly do to make much profit, because a dog can only have puppies twice a year, and depending on what type of dog, let's say it only has 5 or 6 puppies. Well, it costs more money to keep the mother dogs alive and happy and healthy all year long than you can really make in profit on the puppies. So it depends on the type of dog that you're talking about when you ask how much can you get breeding. Some dogs have 10 puppies and some dogs have 2 puppies. Some dogs are valuable and some dogs are not very valuable. Golden retrievers are common and maybe you could buy for $300 to $500. An English bulldog is very uncommon. Maybe you're going to spend $2,000 on up.
What is the average day like for a veterinarian?
Well, in my practice, we schedule a day into kind of 3 different lumps. The first part of the day, I see the surgery dogs and admit them to the hospital and maybe draw some blood for some blood tests to be done. And then I'll see clients that come in with their sick dogs, or maybe they need shots in the morning till 11 or 12. Between 12 o'clock and 3 o'clock, I do surgeries and take care of the sick dogs that have to be, or cats that have to be inside the building, and try to get a lunch in there. And then between 3 o'clock and 6 o'clock or 7 o'clock, we see clients again and take care of their sick dogs and cats until the end of the day. And then most of the time in my situation, in most situations, you'll have meetings once or twice a week, sometimes related to veterinary medicine and sometimes doing other stuff. Most veterinarians tend to do a lot of service for the community and may have to go to a church meeting one night a week, or maybe a Lions Club meeting, or a fundraising for something or another, because veterinarians as a group are very, very people oriented and do a lot for other people.
Do you get house calls?
We get people asking us to make house calls sometimes, but I don't. There are some veterinarians that do make house calls, but I just don't have time to drive to their house and take care of the dogs and drive back and still see the other people that are coming in, so I can't do house calls in my practice.
What is the weirdest animal you have to take care of?
The weirdest animals, well, I'm in a small animal practice, which basically means I take care of people's pets. And so things that people consider pets, I consider weird sometimes. Sometimes people bring, or a couple times people have brought in ducks or geese or chickens that they keep in the house as a pet, and that to me is pretty weird. Regularly people bring in lizards and turtles, and I think those are kind of unusual sort of pets too. And occasionally somebody bring a baby pig or a baby goat in that they keep in their house as a pet, and I consider that kind of weird too. I'm not sure which one of those is the weirdest, but they're all pretty strange to me.
What do you feel is the best thing about being a veterinarian?
Wow, that's a hard question because there's a lot of good things about being a veterinarian. Probably one of the things I like the best about being a veterinarian is that I can adjust my schedule to do what I need to do. So I'm fairly flexible, and I like that flexibility.
What do you feel is the worst thing about being a veterinarian?
Every year, dogs have to have a heartworm test. And so we have to draw blood on these dogs 500 or 600 times each year and talk to owner about heartworms every single year. Fleas in the fall are a big problem, and so we'll have to talk to owners again and again about fleas. So what I like the least about veterinarian is talking about the routine problems that have to be taken care of every single year again and again and again. It gets really boring sometimes talking about the same thing 20 or 30 times a day for 2 or 3 months at a time. And in the fall, we talking about fleas, for example. talking about the same thing over and over and over again for 2 or 3 months of the year. So some things to do as a veterinarian are really, really boring because it's the same thing all the time. It's important because fleas and heartworms can really, really, really make a dog sick or even kill him. So it's absolutely necessary that I talk to owners about those things, but it's still kind of boring saying the same things over again.
Do you sometimes feel like you should change your career?
Would I sometimes do something different? Yes, I practiced for 20 years, and sometimes I would like to spend less time seeing a client and more time teaching. Occasionally, a couple times a year, I'll go to Michigan State University and teach a class for a day or two. And I would like to spend more time at the different universities teaching veterinary students about day-to-day practice instead of doing the day-to-day practice. So that's something that I might change in my career. In other words, instead of being a day-to-day clinical veterinarian, I might become a teaching veterinarian. I'm a veterinarian in either way case. It's just a different way of being a veterinarian.
When you were working with a dog or a cat or any animal, they try and snap at you and bite you.
Oh yeah, they try and bite you almost every single day. Something tries to bite you at least once. The trick is not letting them bite you. And no matter how hard you try, once or twice a year, you're going to end up getting bitten by a dog or a cat, or maybe scratched more often. If you guys are interested in being a veterinarian or any sort of healthcare profession, you're doing the most important thing in the world that you can right now, and that's learning the basics. You guys are all able to communicate very, very well, much better than most of the kids that I've talked to in 4th grade. And that communication skills that your teacher has been teaching you, he's been doing a very excellent job at it, whether it's him or your other teachers, they're doing a good job at it, and you need to keep learning to communicate. Sometimes that's in writing. So when you have to write sentences and write paragraphs and practice writing clearly, you have to be able to do that. If I can't write down on the record properly what I see or have done, the person that's doing it might do the wrong thing and kill the animal. So learning to talk clearly, write complete sentences, this is what you're learning right now in your life. It's absolutely essential. I can't overemphasize that. The other thing that you're learning a lot about right now that is very, very important is your math. Adding and subtracting and multiplying and dividing. I must have to do at least 100 math equations every single day when I'm trying to decide how much medicine to give to a dog. And if I don't multiply right or I subtract wrong, I might give the dog the wrong medicine or the wrong amount of medicine and kill it. Again, that's basic math that I'm doing. Adding, subtracting, multiplying, dividing. And at your age, those sort of things are kind of boring lots of times. It's like me doing the heartworm thing again and again and again and again. You're practicing your times tables again and again and again and again and again. But communicating, learning your math skills, those things you're doing right now are absolutely essential, not only to be a veterinarian, but to be successful in almost anything that you're going to do.
Here is a bird. You hear him? You hear what he's saying? He's saying, here, kitty, kitty, kitty.
When I was like, you guys pet me. I just liked it and petted. Those two, I'm not sure about. They're a little bit scared, and I get nervous about scared dogs.
How come
Missy likes somebody to pet her.
I don't hate them, but they just her. She's sweet. I like her. She's real sweet. Yes, you are.
Still tired.
So am I.
I'm not finished studying yet.
Shut up!
What about a new clubhouse? We can't just stay here now that Vexer knows about us. We'll contact Zoe in the morning. But for now, we might as well start getting the stuff we're taking with us.
You guys go ahead. I'll keep the first watch for tonight.
Oh no! I think the questions might actually catch me. I can't believe it.
Look at her.
The dog is chewing off something under the table. Anyway, Aaron and Lisa, you tie him up when I say so.
Okay. Oh no, the questions might actually get me. I don't believe it.
Well, you better. Anyway, Aaron and Lisa, you tie him up when I say so.
Okay.
Oh my God.
Try it one more time.
I can't.
5, 4.
Anyway, Aaron and Lisa, you tie him up when I say so.
Okay.
Come on.
Hello, my name is Xavier Lathan, and I play Victor on Career Quest. Career Quest is made up of 4th graders from Doyle Ryder Elementary. We would love to hear your comments. Please write to us at Career Quest, Doyle Ryder Elementary, 1020 North Saginaw Street, Flint, Michigan 48501, or write our email address at careerq@aol.com. Thanks.